Today's question is, do men suffer from infertility? That's a great question. And thank you for asking it because it is an important question that needs to be asked more often. Men can absolutely suffer from infertility, and in fact, they are responsible for about half of all fertility problems. So let's talk about what we know about male infertility. When most people think about infertility, they usually think about women. There are so many factors that can make it difficult or impossible for a woman to get pregnant, such as endometriosis, PCOS, uterine fibroids, and so many others. But the fact is that there are just as many things that can cause infertility in men. And some of these are varicocele, erectile dysfunction, low testosterone, and a condition called retrograde ejaculation. So how common is male infertility? Well, according to the American Society for Reproductive Medicine, about 7 to 12% of men have trouble getting their partner pregnant. And this is after you rule out other issues like age, as well as medical problems like diabetes, thyroid disorders, and high blood pressure. So clearly, male infertility is a significant problem that affects many couples trying to conceive. What causes male infertility? I touched on a few of these earlier, but there are actually way more. So let's take a look at some of the most common causes. The first is varicocele. And I'm sorry if I've pronounced that wrong my entire life. I just learned today that it's not varicocele. It's varicocele. I feel like I'm in school again. Varicoceles are probably the most common cause of male infertility, accounting for about 40% of cases. They happen when the veins that drain the testicles become damaged and enlarged. This can lead to a backup of blood near the testicle, which can raise the temperature of the testicles and affect sperm production. Another 35% of the time, male infertility is caused by issues with the testicles themselves. This can be due to a number of things, including undescended testicles, which means that one or both testicles did not descend into the scrotum during fetal development, which can lead to fewer sperm being produced. It could also be due to an injury to the testicles or a genetic condition. And then another 15% of the time, the cause is going to be an issue with sperm production or function. This can be due to a number of things, including issues with hormones or genetics. So there are several different things that can contribute to male infertility, just as there are with female infertility. How is male infertility diagnosed? So if you are a man and you're concerned about your fertility, there are a few tests that can help you learn more. The first is going to be a semen analysis. This is the same for both men and women. It is the first test that will be done because it can give a lot of information about your fertility. A semen analysis looks at the amount of sperm you produce, how well they move, and the concentration. Of course, it also looks at the shape of the sperm, because sperm are supposed to be oval, and it checks for any other abnormalities. Another test that can be helpful for men is a physical exam. This allows the doctor to check for any physical signs of infertility, such as varicoceles, which I mentioned earlier, or an undescended testicle. You may also have blood work done to check for hormone levels, because hormone imbalances can sometimes cause infertility. And finally, you may have genetic testing done, because certain genetic conditions can also play a role in infertility. Infertility is a very difficult topic, and it can be even more difficult for men because so often it is kind of brushed aside and not really talked about. The truth is that male infertility is a real problem that affects a lot of people. So if you are struggling with infertility, know that you're not alone and there are resources available to help you. If you found this video helpful, please like and share it with anyone who might benefit. Also, if you'd like to support this channel and its mission of making education fun and accessible, please consider becoming a patron. Your support allows us to continue producing free videos that reach millions of people around the world. Thank you for watching.